I so appreciate what they've done for me.
Really wanted my life and health back.
He saved my life.
We offer everything from medical weight loss to surgical weight loss, and we don't try to force anybody into a treatment that they don't feel comfortable with. We have full nutritional support, exercise programs. We have a fluoroscopy suite if we need to do post-operative tests so patients don't have to necessarily go over to the hospital. So it really is kind of a comprehensive approach to cover all the needs of the patients.
Dr. McCarty has been doing weight loss surgery since 1998, so he's very experienced in revision surgery. So we currently have a lot of revisions, whether it's lap band or gastric bypass revisions. Our exclusive, most popular procedure is probably the mini sleeve procedure. That is a very minimal downtime, 2 cosmetic incision procedure with no lifting restrictions post-surgery. That's completely different from the laparoscopic gastric sleeve with a 20-pound lifting restriction for 6 weeks. So that kind of sets us apart.
Throughout my career, I've been focused on trying to do things better and easier from the patient's perspective. So what we're doing now, for instance, with the mini sleeve, is just an extension of what I've done over the last 20 years in multiple areas. Things have evolved in that way, doing it less invasively with laparoscopy, or even less than that with the mini sleeve approach. That's really where we focus on, is trying to be innovative, stay ahead of the curve, offer the latest that's available as long as it makes sense, right, and is a benefit to the patient. So we offer the gastric balloon, we do the mini sleeve, we try to offer services that are innovative, but also safe and effective.
You know, when I went in for the surgery, I weighed 440 pounds, and I never thought I'd get that big. And I had to do something. And when I came out, you know, within a month, I had lost like 60 pounds.
It's been a life of heaviness. I weighed 450 pounds and really wanted my life and health back, and started, and now I'm 302 pounds lighter. And it's been 10 years this year. I'm actually smaller now than I was in the 6th grade.
When I came in, I wanted to know just kind of the do's and don'ts. Then once she explained everything, I was like ready to do it the next day. I had my surgery on Tuesday, and I returned to work on Friday. And it worked. The weight just really fell off after the fact. So it's definitely a good experience.
Yeah, with respect to how we run the clinic and the employees in the clinic, we have a particular emphasis on compassion and understanding for people who are overweight. There's no judgment here. Everybody has compassion for our patients. I promise you, every employee in this clinic wants to help. All of the employees are united in their approach to it, and I think most people who experience the clinic really like the experience. We're very down to earth. We want a long-term relationship with our patients. We encourage them to call when they have questions, even after surgery. I encourage patients, if they're having a problem, I need to hear from them. Open communication is imperative.